Well, hey there, Andrew Grecki, and I wanted to give you a quick preview. This month, September, we're going to be talking about the foot. The reason we're talking about the foot is because as we get into September, October, November, it's a really popular season for runners. And we start to see a lot of marathons in the fall, and we start to see a lot of foot pain with runners and walkers. The topic for this video right now is one of my biggest frustrations that I see when working with patients with foot pain. And I have our little handy dandy foot model here to try to help explain the thought process. But commonly we'll get three areas that cause pain in the foot. The arch, which is called plantar fasciitis, the heel, which is called Achilles tendonitis, and then the big toe, which a lot of times it turns into a bunion, but it can hurt without a bunion. One of the most frustrating things that I see that are given to patients, not only information but treatment, is the use of a walking boot or a cast. This is oftentimes given after the patient has foot pain for a while and they've been given medications, and the next step a lot of times is, well, let's just put it in a boot and we'll rest the foot, and we'll just get you to not use the foot for 4 to 6 weeks, sometimes longer. And yes, I understand the concept of taking away stress from a tissue that's damaged and allowing it to heal. One of the coolest things of our bodies is that our body, if given the right environment, it will heal itself. So the boot is the doctor's attempt at creating an environment so that the structure can heal. The problem from my perspective, though, is not only does that not address the problem that's causing the stress in the foot, but it also makes matters worse. And it's oftentimes wasted time and wasted money. Let me explain why it would make the foot pain worse. So let's talk about both plantar fascia underneath here and Achilles. Those two structures are stressed out the most when the foot hits the ground. The foot is designed to flatten out like a pancake, okay? That word is called pronation. So when the foot hits the ground, you can even just imagine that plantar fascia is underneath there and it gets stretched out when it hits the ground. Same thing with the Achilles. It runs to the back of the heel and comes down to the heel from the tibia, and as you flatten the foot out, it causes lots of stress on the medial side of that. You can even just see that. It just flattens out and everything has to decelerate the flattening out in the foot. So when you put somebody in a walking boot, it completely immobilizes the ankle joint and it stops the arch from flattening on the ground. There's no more flattening, no more pronation. So it basically casts up the foot. So as the person's walking, they're not getting any motion. And yes, oftentimes that does provide some relief and some healing that happens. But as soon as that person takes off the walking boot or the cast, one of the things that you'll notice, among many others that the body develops in adaptation to that lack of motion, is that this ankle joint right here doesn't move anymore. It's very stiff. So if you can see from the side, the ankle joint has to move. When the ankle joint moves, that's when you get towards the end range, is when things flatten out and then you go through that mid-stance phase. So if I look at somebody who comes out of a walking boot, the first thing that I'll notice is that the ankle joint doesn't move anymore. It might move, but not very much. It doesn't move like it used to move. And so the problem is that when you look at the body's ability to compensate, when you're going through heel strike and you are asking your ankle to move right before the foot flattens out, if the ankle doesn't move, you're going to get, the body's going to go, well, I can't move this joint anymore, but I can do more of this, and I can also do more of this, where the foot turns to the outside. So you'll see somebody that goes like this. They flatten out, and then the foot rolls to the outside, and then they push off. Well, that just amplifies the stress that happens on the Achilles tendon back here, as well as the plantar fascia and the big toe. So it actually makes things worse in the long run. And then we have to spend in physical therapy all this time trying to get this ankle joint to move better, when the ankle joint probably moved fine before they were put in the walking boot. And then not to mention that thought process of putting somebody in a boot is really eliminating all other things in the body that could be contributing to this part hurting. It's saying, well, it must be your foot's fault. And we know that the foot is connected to the knee, and the knee is connected to the hip, and the hip's connected to the low back, and the low back's connected to the upper back, and there's arms and there's heads, and everybody's moving freely, and everything from my head down to my foot causes motion in my foot. And if you don't believe me, take off a shoe right now, go barefoot, and then move your arms and look down at your foot. You're going to see pronation and supination. So a walking boot is really just addressing the pain. It's not fixing the problem. It's actually making the problem worse. And I've seen it thousands of times. And so that's why I'm here to just kind of offer you a little bit of better information, and hope that you might consider doing something else besides a walking boot for your foot pain. And here we are, the month of September, we're offering free 10 only free foot screens to you, and you being past patients or people that you know. This is not a general public thing. This is only for our past clients. So it's very rare. We only have 10. They will fill up. Every month they fill up. So if you're interested, you got to email me back or just call us at the clinic, and we'll offer you, if we have them left, a spot for a free 20-minute foot assessment to help you understand whether or not you're missing something. Hope you're doing well, and thanks for listening.